Hello my friends, this is Dr. Jaime Daniel, and today I want to share with you an overview of back pain. Back pain is one of the most common medical problems in the world. It can range from a dull, constant ache to a sudden sharp pain. Sometimes it can come on suddenly from an accident, a fall, or lifting something heavy. Or it can develop slowly because of age-related degenerative changes to the spine. In some cases, inflammatory disorders or other medical condition causes back pain. Treatment varies depending on the cause and symptoms. However, there are steps you can take to improve your health and lower your chance of developing chronic or long-standing back pain. There are many different structures in the anatomy of the back that work together to support your body. Problems with any of these structures can cause back pain. Remember, there are 4 regions in the spine. The first one is the cervical spine, the second, thoracic spine, the third, lumbar spine, and the fourth is the sacrum and coccyx. Also, we got parts. There are the vertebrae. They are small bones stacked on top of one another, which protect the spinal cord. There is a spinal cord. It is a long bundle of nerves that run down the back through a canal in the vertebrae. Intervertebral discs. They are cushion-like pads between the vertebrae that act like shock absorbers and spaces for the spine. We also get ligaments. They are short bands of tough, flexible tissue that hold the vertebrae in place. The tendons, they are cords of tissue that connect muscles to bone. And of course the muscles. They are a bundle of dynamic fibers that support your spine and upper body and help you move. It is very important to remember that anyone can have back pain. However, several factors increase your risk. Risk factors increase your chance of developing back pain, and they can include things like your fitness level. Yes, the back pain is more common among people who are not physically fit. For example, weak back and stomach muscles may not properly support your spine. Back pain is also more likely if you exercise too strenuously after being inactive for a while. Remember also the weight gain. A diet high in calories and fat combined with an inactive lifestyle can lead to obesity. This can put stress on the back. Also, there is a problem with your job. Yes, there is a job-related risk factors. Your job may require you to heavy lifting, pushing, pulling, or twisting can injure the back. A desk job may also play a role, especially if you have a poor posture or sit all day in an uncomfortable chair. Remember, the age also plays an important role. The back pain becomes more common with age, particularly after the age of 45, and genetics play always a role in all the disorders. There are types of back pain. One of them is acute back pain, and it happens suddenly and usually lasts for a few days to a few weeks. There is subacute back pain and can come on suddenly or over time and last 4 to 12 weeks. And finally, we got the chronic back pain. It may come on quickly or slowly and last longer than 12 weeks. The back pain can range from local pain in a specific spot to generalized pain spreading all over the back. Sometimes the pain radiates away from the back to other areas of your body, such as the buttocks, legs, or abdomen. The intensity of back pain varies for each person, depending on the type, cause, and location of your back pain. You may experience things like increasing pain with lifting and bending, worsening pain when resting, sitting, or standing, back pain that comes and goes, stiffness in the morning when awakening, and lessened back pain with activity. Pain that radiates away from the back into the buttocks, legs, or hips. Probably you should look up for medical attention if your pain does not improve after a few weeks, or if any of the following symptoms that I will list now happens in your back. Probably you feel numbness and tingling, severe back pain that does not improve with medication, back pain after a fall or an injury, back pain along with trouble urinating, weakness, pain or numbness in your legs, fever, weight loss that you did not intend to do. The back pain can be caused by many different things, including mechanical or structural problems with the spine, inflammatory conditions, and other medical conditions. The back pain can happen when mechanical or structural problems develop in the spine, discs, muscles, ligaments, or tendons in the back. For example, we get a sprain. It is an injury to the ligaments that support the spine, often occurring from twisting or lifting improperly. There is also strain, an injury to a muscle or tendon. We got the degenerative disc disease. It happens with aging and causes the discs between the vertebrae of the spine to break down. Also, the herniated or ruptured discs. It happens when the discs compress and irritate nearby nerves. This often occurs at the lumbar level. Spondylolisthesis. A vertebra in the spine slips out of the place. Spinal stenosis is a narrowing of the spinal column that puts pressure on the spinal cord and nerves. Fractured vertebrae. Scoliosis or other congenital changes to the spine. And about the inflammatory conditions, we can say the ankylosing spondylitis. It is a specific type of arthritis of the spine. And we also got the osteoporosis, which can lead to painful fractures of the vertebrae, fibromyalgia, a condition widespread muscle pain and fatigue, kidney stones or infections, endometriosis, which is the buildup of uterine tissue in places outside of the uterus, infections that involve the bones of the spine or the discs between these bones, which can cause pain. Also tumors in rare cases that develop in the spine or other areas of the back, and pregnancy. It is important to you to know that in order to diagnose the causes of the back pain, your healthcare provider may ask you some questions like, can you describe your pain? Is it sharp, itching, burning? Where is the exact location of your back pain? When did the pain start and how long have you had the pain? What are you doing when you first noticed the pain? How severe or bad is the pain? What makes the pain worse or better? Probably he will also ask you about to rate your pain on a scale from 1 to 10 to gauge the severity of the pain and talk to you about your ability to perform activities of daily living. He may suggest you some exams, like X-rays. They are used to show only bones and helps to diagnose broken bones or fractures, changes due to aging, changes in the alignment of the spine. But when you need to see the soft parts, you may be suggested to get a magnetic resonance imaging or probably a computerized axial tomography. Also, if he's suspecting of inflammatory disease, we'll ask you to get blood tests to identify this and other possible causes for the back pain. About the treatment, you can use some medications, always with a prescription. There are some other treatments, yes, like the use of cold packs to help relieve some back pain and hot packs to increase blood flow and promote healing in the muscles and tissues of the back. Also, you should avoid bed rest. Instead, limit activities or exercise that cause pain. Gradually increase physical activity as tolerated. Get physical therapy to help strengthen the muscles that support the back, which can improve motility, postures, and positioning. Strengthening exercises can also help decrease pain. Changes in your lifestyle will teach you to move your body properly when performing daily activities, especially those involving heavy lifting, pushing, or pulling. Avoid any activities that cause or increase pain. Practice healthy habits such as an exercise, relaxation, regular sleep, healthy diet, and quitting smoking. Remember, there are complementary and alternative treatments that may help relieve pain. For example, manipulation of the spine and nearby tissues. It is done by professionals that use their hands to adjust and massage the spine and muscles. Also, there is the transcutaneous electrical nerve stimulation. It sends mild electrical pulses to the nerves through a device and electrodes or pads that are placed on the skin. These treatments are not always effective for reducing the pain. There is also the acupuncture, that is a Chinese practice that uses thin needles that may relieve pain in some patients. Also, depending on the degree and condition of the back pain, you can be suggested to get a surgical treatment. There are different types of health care providers that can treat your back pain. For example, pain specialists, family or primary care doctors, orthopedists, neurologists, neurosurgeons, rheumatologists, physician therapists. Living with back pain can be challenging. However, most people find relief within 6 weeks. Remember to follow the recommendations of your healthcare provider. You can add exercises gradually and talk to your healthcare provider about the types of exercises that are best for you. There may be certain activities or exercises you should avoid. When sitting for a prolonged period, get up, move around, and switch positions frequently. Wear comfortable shoes with a low heel. When driving long distances, try adding some support behind your back and stop frequently to stand up and walk around. Sleep on your side and place a small pillow between your knees. If you tend to sleep on your back, place a pillow under your knees. If possible, try to avoid sleeping on your stomach. Limit the amount you carry. Instead of carrying more items at once, make a few extra trips to avoid carrying too much weight. You may be able to prevent back pain from overuse or improper body mechanics. There are some recommendations that may help you to have a healthy back and lifestyle. Perform regular exercise that keeps your back muscles strong. Exercises that increase balance and strength can decrease your risk of falling and injuring your back or breaking bones. Exercises such as Tai Chi and yoga, or any weight-bearing exercises that challenges your balance, are good ones to try. Remember to warm up before exercise or other physical activities. Eat a healthy diet that includes enough calcium and vitamin D, nutrients that keep your spine strong. Maintain a healthy weight. Being overweight can put unnecessary and injury-causing stress and strain on your back. Practice good posture and avoid slouching. Try to remember to support your back when sitting or standing. Avoid lifting heavy items whenever possible. If you do lift a heavy item, use your legs and abdominal muscles instead of your back. Well, I hope you enjoyed this episode, and we will see you in the next one. Thank you.